years, we've come out of COVID and been able to bring patients back to the dining room, which is what we always used to do. We used to have a routine of going down to the dining room for all meals actually, but just in terms of regaining that practice, we've focused on lunchtime.
And then as we were going out of the pandemic, then we started getting more patients together. Then after 1 bay was 2 bays per day. And then when the infection risk was to a minimum, then we could have all patients that we wanted to in the dining room. So it looks like quite busy, busier than before. And it's very nice to see patients talking to each other, talking to the staff as well, and engages more in rehab, so patients and their mood as well, it gets better, and also the intake improves because they're eating more, they are in an environment where they are encouraged to eat and drink as they would at home.
The more we can get people out of bed and moving and sitting up, but people tend to prefer to get out of bed for a reason, which is understandable. So this is the perfect reason to give somebody, to give them back a bit more of their daily routine and to give them a reason to get out of bed and to stay out of bed for a little while as well.
Well, it's better than eating on your own by your bed. It's better to see people from other wards apart from what you're doing, and to just to hear how they feel, where they come from, and just typical conversation, really. Yes. It was quite friendly, and I can't say I found any of the staff anything but helpful. If you want anything, they come and help, yeah, and they're friendly. Here, I'm in control. If I'm in bed, it's at the level at which the nurse puts the trolley, and somehow it's better to be sitting eating in a normal, it's much more normal to eat at a table.
We had a goal of getting 3 out of the 4 patients to the dining room, so everybody was getting an opportunity once a week to go to the dining room. It wasn't enough of a shift change, I think, in terms of improvement. So we had a new goal of I think it's 60%, so we were looking to get 15 people down to the dining room. But it definitely makes a difference in terms of the patients practicing physical skills, cognitive skills, communication skills. And as speech therapists, we have the big focus on the swallow as well. So of course we're interested in making it as easy as possible and as everyday as possible for somebody to be able to eat and drink, and that is up at the table. Because it does have such a big impact on our rehab activities, but also on patients' progress, their mental health, their engagement in their therapy. If they've had a nice chat and a good lunch, they're going to be up for doing more. They're going to be more motivated as well.
But by getting the patients together in the dining room, as I said, socializing, talking to each other, talking to staff as well, it improves the whole rehabilitation process, and also gives a meaning to our rehab ward, and it gives us back the rehabilitation environment that we unfortunately we lost during the pandemic.
It's different. It's getting back to what it used to be, where they're coming down, they're more of a social group, they're chatting, they're meeting up. It's much more lively.
The patients love coming in there, socialising. They meet people from different bays.
Yeah, you can see that they're much more open with people, and they do seem to recoup quicker once they start mixing and socialising again.